Hello, my name is George Kovalevsky, and I'm a reproductive endocrinology and infertility specialist at the Delaware Institute for Reproductive Medicine, with our main office located in Newark, Delaware. Today, I would like to talk to you a little bit about what it's like to start your care at our center. There are many reasons why patients come to see us. The number one most common reason is infertility. Individuals or couples who are having difficulty achieving a successful pregnancy. There are other reasons as well, including individuals who are single, who would like to have a child, or same-sex couples. Others come for fertility preservation. And then some are not even trying to achieve a pregnancy. Some are simply coming for evaluation of reproductive endocrine problems. Of course, depending on what the initial issues are, the testing will be modified accordingly. But for the standard patient who's coming in for an evaluation of infertility, I can review what a basic path would look like at that point. The first thing that usually happens is that we would have a consult at which I would review all of your history and based on that, make a plan as to what testing needs to be done. Testing usually is required for us to get a full understanding of what the issues involved are so that we can then select the most appropriate treatments. So if we're starting from the beginning, the tests will fall into three main groups. Group one will be imaging. So we're going to want to get a good look at the uterus, the tubes, and ovaries. And there are various ways that we can accomplish that. Usually, the first of the imaging tests is a basic ultrasound that allows us to get a really good look at those structures. And then we often want to see more. We want to see, is there anything wrong in detail on the inside of the uterus? And for that, we have a couple of tools. The most common one we use is an office hysteroscopy. We take a little camera and look into the uterus to see if there's anything that could be wrong there. We want to check the fallopian tubes usually to make sure the tubes are open. And again, we have two different options how we can do that. The most common test we use is a sonohysterosalpingogram, where we put a little catheter in through the cervix and then put water and air bubbles into the uterus, then watch with ultrasound to see if the bubbles go through the tubes, telling us that the tubes are open or not. So those will be the imaging tests. The second category of testing is blood work. There's a lot of blood work that we want to do for the average starting patient. This includes a battery of tests for any woman who is interested in becoming pregnant, because our goal is not simply to achieve a pregnancy, but to give you the best chance of having a healthy pregnancy. So we want to know things like your blood type and antibody screen, blood counts, looking for immunity for German measles and chickenpox, looking for infectious diseases, HIV, syphilis, hepatitis, gonorrhea, chlamydia, mycoplasma. You check a number of hormones depending on exactly what's going on, but the most common hormones include thyroid and prolactin, and hormones that tell me about the ovarian reserve, how many eggs are left in storage. And these are hormones called AMH, FSH, estradiol. The third group of tests is for male partners, and their testing is much easier, so it's not very fair. The males have to do only one important test, and that's the semen analysis. We count the sperm, look at their shapes, and see how they're moving. We usually will screen male partners with blood tests for infectious diseases as well. Much of the testing is done in accordance with the menstrual cycle. So the first day of full flow bleeding is considered day one of the cycle, and we count the days from there. Day 3, or close to day 3, is when we want to check the main hormones, and usually the baseline ultrasound will be done at that time. The other imaging studies would be done usually between days 5 and 12 of the cycle. And therefore, treatment can begin usually within 1 month from the initial consult. So at the initial visit, the tests will be selected as to which testing we want to do. And then once the tests are completed, I would ask you to come back so that we could go over all the results together. And based on that data, then we would be able to make some conclusions and then decide how we can best proceed with helping you achieve your goals.